Okay, hi again. Can you all hear me all right? Yes. Great. I would like to ask Bruce Barnard to join me on stage, along with Super Captain Carrie Bogus, Lieutenant Mark Vogelzang, and Officer Brian Tyson for this next award. And as they're making their way up here, y'all can, Bruce, you can be next to you. We have S's on.
It's like TV.
So, yes. So, Captain Carrie Bogus in the middle here is the jail superintendent for the Champaign County Sheriff's Office. Lieutenant Mark Vogelzang is a CIT officer with the Champaign Police Department. And on the far end is Officer Brian Tyson, who is the CIT coordinator of the University of Illinois Police Department, and he is also on the county's CIT steering committee. Thank you all so much for being here with us this evening. And good news for everyone tonight. Instead of having to listen to me talk so much, I'm very pleased to say that I successfully roped Bruce Barnard, a friend and colleague, into doing this awards presentation this evening. Before Bruce presents the award, let me just give a little bit of background. A few years ago, Healthcare Consumers was invited to become a stakeholder and partner in some important work dealing with reentry services in our community and with the Justice and Mental Health Collaboration Program. Reentry services refer to the services available to people who are returning to the community following an incarceration. Both of these efforts brought together law enforcement, mental health, behavioral health, substance abuse treatment providers, social service providers, local government, and advocacy organizations. The goals of both efforts overlap a lot. Generally speaking, these community collaboration efforts seek to reduce recidivism and to reduce the number and length of incarcerations of individuals with mental and behavioral health needs. Healthcare Consumers' role in this work is to help provide enrollment and benefits assistance to people in the jail, as well as to people who are referred to us through these other agencies and law enforcement. People's lives are messy, and this can be really hard work. The people standing up here with me tonight understand that. They bring to their work an ethic of caring and a commitment to help improve people's lives while serving the public's safety. Most people in our community do not know about these crisis intervention team services provided by law enforcement. What I have learned from working in these collaborations and also through personal experience when I myself have had to call for CIT with clients is that the officers who do CIT work are frontline, on the streets, mental health, first responders, even though they didn't choose that career. They are an essential but almost invisible part of the fabric of our mental health system in this community. But Bruce will tell y'all more about their work, so let me go ahead and introduce Bruce. Bruce Barnard is currently on the faculty of the School of Technology at Eastern Illinois University and the program coordinator for the Bachelor of Science in Organizational Development program. He served as project director of the Justice and Mental Health Collaboration Project and currently chairs the Reentry Council for Champaign County. His professional experience includes more than 30 years of leadership experience in community-based addiction and mental health services, including detoxification, residential, outpatient, and transitional housing. Bruce's teaching is focused on organizational development, teamwork, and strength-based approaches to development, preparing the next generation of community leaders. I have known Bruce for a very long time, but I have been fortunate to work with Bruce for a few years now in his capacity as chair of the Reentry Council and project director of the Justice and Mental Health Collaboration Program. Bruce is an amazing resource. His knowledge of these issues and so much more is encyclopedic, and our community is fortunate to have his expertise and guidance, and I find him to be delightful. Bruce, I happily relinquish the podium to you.
to crisis intervention team officers on behalf of the Champaign County Healthcare Procedures. My background is in addictions and mental health services. In those fields, we have a concept called no wrong door. Because mental illness and the disease of addiction carry stigma and shame, and it is sometimes difficult to access and ask for services, a community can have no wrong door to ask for help. No door that does not provide a compassionate response and a linkage to care. Persons struggling with mental illness are seen in the criminal justice system at disproportionate rates. While persons with mental illness are no more likely to be violent than the general population, and that's an important point. We all know that law enforcement interactions can end tragically. For the person with a mental illness, for bystanders and family, and yes, for the officers as well. Nationally, there are more than 2 million annual bookings, jail bookings, involving a person with mental illness. The largest provider of mental health services in the state of Illinois is the Cook County Jail. Let that sink in for a minute. The 3 largest providers nationally of mental health service are all county jails. In Champaign County, we know that 25 to 30% of the people booked into the Champaign County Jail are in need of additional assessment and linkage to behavioral health services. They often need assistance in obtaining health benefits. And as you learned tonight, Chris Garcia is at the jail providing that service. They also need housing. They need linkage to community services. And when Courtney's not taking pictures, she's at the jail linking people to behavioral health services. In Champaign County, we are fortunate to have a coordinated effort among law enforcement jurisdictions to respond to persons with behavioral health problems. More than 100 law enforcement and corrections officers have participated in crisis intervention team training. This is a national model. Champaign County was an early adopter, and it's been shown to be very effective across the country. This is not something these officers are required to do. This is something they have chosen to do in order to better serve their community. Crisis intervention team training is a 5-day course for law enforcement and corrections officers covering issues such as the signs and symptoms of mental illness, substance abuse and co-occurring disorders, autism and intellectual disabilities, psychotropic medication, post-traumatic stress response, as well as issues uniquely faced by the elderly, returning veterans, children, and adolescents. The training includes de-escalation strategies, role plays, understanding of how to respond to mental health crisis, and what local resources are available. The sheriff and the chiefs of police in Champaign, Urbana, Rantoul, University of Illinois, and Parkland College all support CIT training for officers. A cross-jurisdictional agreement ensures that a CIT trained officer is available to respond at all times in the county. A dispatcher can request a CIT officer, or, and it's important that you let people know this, a 911 caller can request a CIT officer. In Champaign County, there are about 150 calls a month for a CIT trained officer. CIT calls often take longer, require more assessment and problem solving than other routine calls. The most frequent calls are those related to suicide attempts or suicidal ideation. The calls may involve transporting someone to the hospital for evaluation, voluntary admission, or commitment. The call may be resolved at the scene. And yes, sometimes there is no choice but to make an arrest, which is why it is important that we also have CIT trained correctional officers at the jail. There is no doubt that the commitment of these officers and the training they have received has saved lives, prevented unnecessary incarceration, and provided linkage to community services for thousands of individuals and families in Champaign County. A law enforcement or correction officer cannot say, no, this is someone else's job. Whatever the problem, whatever the situation, they have to find a way to deal with it. And they have to use the community resources that are available. They need our help. As community providers and advocates for healthcare, we owe it to these officers to ensure that when they respond to someone with behavioral health needs, that the community stands behind them with the health resources, behavioral health resources, housing and advocacy services that are needed to meet those needs. When I became involved in justice and mental health collaboration work in Champaign County, I started looking at recidivism statistics and service gaps, and frankly, it can be a bit depressing. But when we started to meet with stakeholders and explore opportunities to do better for our community, I was encouraged by the compassion and professionalism of law enforcement, corrections officers, treatment providers, and community advocates. And I do want to quickly thank Claudia Lennhoff, Chris Garcia, Brian Tyson, and Kerry Vogus, who all served on that steering committee. As I began to look at the resources we had in the community, including CIT, jail-based services, community providers, I was reminded of something that Mr. Rogers said. He talked to children, but it was with messages that we need to hear as adults. And he said, when you feel overwhelmed by a tragedy, look for the helpers. Look for those who are trying to help. This award is well deserved. Every officer who has made a commitment to receive crisis intervention team training and the leadership supporting their efforts have earned our gratitude. They are the helpers. And I'm going to embarrass Captain Vogus for just a moment. When I talk to my colleagues across the country, very few have been as fortunate as we have been in this county to have a willing partner at the county jail. It has been a privilege to work with her in our efforts to reduce jail population, recidivism, jail-based services, and linkage to community-based services. Those efforts led to our county receiving national recognition as an innovator county by the Council of State Governments, the American Psychiatric Association, and the National Association of Counties for our work on jail-based screening and linkage to services. There is much work yet to be done, but today, let's take a moment to thank these fine officers for their commitment and compassion. It is my privilege to present y'all with the CCHCC's Harry J. Baker Community Service Award. Thank you. And she just said, I'll get you later.
No, I didn't.